Hi, everyone. I'm Risha. I'm the chair of the Board of Health, and we will open the Board of Health meeting on February 4th at 5:05. Thanks, everyone, for waiting those few minutes. So I will take attendance just by noting who is here. So I myself am here, Betsy Brooks is here, Premila Nair is here, and Jack Jemsek is here. That is the entire board, so we are all in attendance. And with that, we will jump right in to the agenda. And the first order of business is to review the minutes from the last meeting. I did not see anything that caught my eye as needing change or comments. Did anyone else see anything?
I thought that the discussion was about how Northampton decided to ban all Kratom products.
Was that not right?
It says that they only ban the synthetic. And I know that because I listened to their meeting in October. So I'm just confused about why it says that. Unless they've changed it, they have in fact banned all Kratom products. There's it was decided in the October meeting.
You're right. I think that's not quite an accurate portrayal of that conversation. So the original Board of Health of Northampton's regulations only had synthetic, and then they changed it to ban all forms.
Yep.
And so I think that's not captured.
Mhm.
Is that an accurate correction there from what I just said? Okay, great catch. Thank you for that.
Thanks, Premila. That's a big oversight on our part. I just didn't read that closely. I mean, everything read well, and I didn't realize that it was actually not accurate. So something got lost in translation there with Nancy writing up the minutes from the recording. Sorry, that needs to be changed. Well, thank you for catching that. We'll make that edit.
Yeah,
sure.
Any other things that anyone caught? I'm going to take that as a no. So does someone want a motion to pass the minutes with that change that Premila has indicated?
So moved. Yeah.
All right. I'm going to take Betsy as the move.
So
Jack
mover.
as the second. And all those in favor say aye. And it is unanimous. We will pass the minutes with that change.
Thank you, Premila.
Sure.
Love people with good eyes to catch those things. All right. For anyone in attendance, I just want to be clear on our agenda in case you haven't seen it. It was updated. So we will have a section for public comment now. We will then go into old business, which is the Kratom regulations. We have 3 items of new business: a well approval, a request for variance on body art regulations, and a tobacco permit transfer. We'll then have a director's update if there is any topic not anticipated by the chair 48 hours prior to the meeting. And then we'll have another public comment. We try to allow a public comment at the beginning and end of every meeting because we are not able to bring people in to discuss items as we are discussing them. So you have a chance to comment before and or after as you wish. So we will now open up for the first public comment. I always forget how long it is. Is it 3 minutes, Kiko?
Sorry, I was having trouble unmuting. It's usually 3 minutes, yes.
Okay, I don't know why that can't sit in my brain, but we ask people to limit their comments to 3 minutes. We also ask that you introduce yourself, including your where you live, your area of residence, and particularly if you are an Amherst resident. And how we will handle this is raise your virtual hand. I see a few already have, and Maheen will promote you to be able to speak, and you will be on video in the order she sees them.
Okay.
I'm gonna call on Juliet first. I'm gonna allow you to speak. Please unmute yourself.
Okay. Can you, no, you can see me?
We can hear you, which is fine. We can't see you, but that's okay if you don't want to or if it's difficult.
I don't, is Megan's hand up? Because I don't want to steal all the time. Maybe you can split it. I just want to give a backdrop. We are residents of Olympia Oaks, which is right behind the massive fire burnt site. And we have been working with different people, different departments like fire department, inspection services, and Kiko herself in public health, who have just put out a health advisory that was sent to our property management here in Olympia Oaks, which will, she said, be distributed Friday, but hopefully maybe before, if God willing. And I was here to just kind of give a backdrop because they're removing the rubble, actively removing it since the 23rd of January, and it does kick up quite a bit of, you name it, dust. They try to mix it with snow, but the children have been standing near the bus stop, but people are working on that to see how we can protect the children, like whether move the bus stop or whatever. But the need has been great, and for me, it's been a real learning experience. And I just wanted to shout out the Public Health Advisory and the Public Health Director, Kiko, who's here, thanking her for her work on this, because I know it's not the only thing that's around, but it's a challenge that is going to keep going forward. It doesn't disappear readily, even when the rubble stops. So I just wanted to people, thinking how individuals in our communities and organizations all together can keep learning to be better equipped to respond to any and every threat, toxic, whether it's material or otherwise. And so that we keep asking those messy questions. And we need masks. We need the response, from Kiko's been great. We just need to keep going. And I just wanted to say that. And if I can, Megan, have time to say anything?
We'll call on her in the order. I don't know if she's next, but yes, I do see a hand.
Go ahead.
Is there anything else you wanted to say, Juliet?
Thank you.
Okay, thanks so much.
Okay, Megan Williams, I will allow you to speak. Please unmute yourself.
Okay, can you hear me?
Yes.
Awesome, thanks. So yeah, I am another resident of Olympia Oaks here in Amherst. I really appreciate Kiko issuing a health advisory from the health department at the start of the rubble. And I guess I'm just, again, like Juliet said, I'm concerned about the air quality, especially as the kids wait for the bus in the mornings, because it's right really close to the debris. And I'm also concerned about like leaching and groundwater contamination. I'm hoping that as we move forward, the town can be more communicative with residents as removal continues, and as we prepare for, we have that other fire, actually my old apartment building, that burned within Olympia Oaks, that will also be demolished later this year as well. And so I have to run to go pick up my kids, so I can't stay for the remainder of the meeting, but really hoping to hear more from the health department and the Board of Health and the town about your plans to, monitor air and water quality after these fires and how we can protect other residents of the community. Yeah. So thank you.
Great. Thank you very much.
Okay, next is Laura Romney. I will allow you to speak. Please unmute yourself.
Hi, can you hear me?
Yes.
Yes.
Hi. I'm glad. Thanks for letting me speak today. I'm calling. I have had some correspondence with Kiko. I appreciate all of the comments that she has sent over about this really important issue of kratom in your community. I just highly recommend that you choose to regulate natural kratom and ban the synthetic products. I know that you've, mentioned Northampton a little bit. They originally had decided to ban synthetics, and then they have then, as you said, tacked on the natural. But a lot of these cities, what they've done is they've felt like, it's just a little bit too overwhelming for them to be able to, regulate, and so therefore they've chosen to ban. But that is a really big mistake. You're really jeopardizing the lives and the health of a lot of people in your community. One thing I want to bring up is that South Hadley just made a great decision about 2 weeks ago to pass an excellent regulation where they actually regulated whole plant kratom and then banned the synthetic products. So they've put together a fantastic, regulation there. So there is a way to do this. I know I've been, again, sending some emails to Kiko about how it's really not super complicated to discern between the good products and the bad products. And, it's once you've kind of cleaned house to a lot of your smoke shops or stores that are carrying this, it won't be difficult at all to be able to, maintain those standards based on very, simple, looking at the backs of the packages and even keeping track of those products that are being sold in the stores. So again, one thing I want to say too is just last week, the Trump administration again had another press conference when they unveiled their new drug policy. And at the very end of it, which I can send you the recording, they once again reiterated what they did in July of last year, that they are going to go full force in scheduling 7-OH and synthetics. And they're not touching kratom. They didn't even mention kratom. It's only 7-OH and synthetics. So again, I highly suggest that you follow along with what the FDA and HHS are doing and responsibly regulate natural kratom and ban 7-OH, because that's really the issue that you guys are facing as a community. It's extremely addictive, and it just has no safety record or science, where kratom in general has hundreds of science to back it. And again, I'm more than happy to answer questions. I have a lot of experience with this. I educate localities all the time, and so when you guys are discussing it and you're open, I'm more than happy to act as I guess you could call me an expert in this field. And so I'd be happy to answer any questions and hopefully clarify anything that you guys might be wondering about. But thanks for letting me speak today.
Thank you.
Okay, next we have iPhone Jen. I'm going to allow you to speak. Please unmute yourself.
We're not able to hear you yet if you're speaking.
Looks like you're still muted.
All right, we'll give a few more seconds, and if not, we will have to move on.
I'm not able to unmute you. Let me see if I can do that.
It's also possible they stepped away from the computer.
Yeah. Okay.
All right, Maheen, I think we...
Oh, gone.
All right. I don't see any other hands, so that closes the public comment. Thank you all. There's a hand right as I said that. I'm willing to make an exception if one more person wants to speak.
Okay, Shannon Lee, I will allow you to speak. Please unmute yourself.
Hi, how are you? Good evening. I'm Shannon. I'm a lifelong resident of Massachusetts, and I just wanted to say there are a lot of people like me right here in Mass that are terrified to know that people will suffer in pain if natural whole leaf kratom is totally banned. It doesn't just affect our state, but our whole country as a whole. The chronic lower back pain I've experienced before I found whole leaf kratom. I cannot even begin to explain what I went through. I am a healthcare worker, and I can't imagine trying to work in total agony. Please, instead of banning natural whole leaf kratom, please look into regulating it. Our neighbor, actually, Rhode Island, banned kratom in 2017. They did the scientific research and they reversed the ban as of April 1st, 2026. The FDA also announced in their July 29, 2025 press conference that they are not interested in scheduling kratom. They only want to ban the synthetic 7-OH. Like Laura says, South Hadley just passed the regulation on natural leaf kratom, and they're banning 7-OH. And I also support the ban on 7-OH as well. Thank you so much.
Thanks. And just for the record, I believe you're from Somerset. Is that correct?
I am,
Okay.
yes, from Somerset.
Great. Thanks.
Thank you.
Okay, we have more hands, so we'll keep going.
Okay, Shane, I'm going to allow you to speak. Please unmute yourself.
Hi, my name's Shane, from Medford, Mass. I'm just calling to again stand by whole leaf kratom and promote regulation versus synthetic. Been a lot of bad misrepresentation about kratom in the public eye due to the 7-OH culprit. If science prevails, you could recognize that kratom has a history of science behind it, raw leaf kratom, that is, to support its safety, not only in harm reduction, but also for chronic pain for others. But, you know, if you really look at some of these folks that are supporting the banning of kratom, specifically in the House and certain groups, you'll recognize that there may be behind them folks who are in, you know, the state house pushing for this banning because they may be promoting, let's say, other prescription medications to help with harm reduction, such as Suboxone. And they're claiming that this medication may be less harmful than, let's say, kratom, which is a natural leaf product with less adverse effects. So these are other things to consider when we hear about those that are against dangerous, I forget what the name of it, danger, kratom against danger, whatever the name of the organization. And if you look behind it and follow the money, you can see that there's really a lot of state representing about, you know, prescription medication overcoming the kratom raw leaf. I thank you for your time.
Thank you. All right, this time I'll pause a little longer to make sure nobody else has any further comments. And since I see no, oh, every time. All right, one more.
Can they make a comment twice?
Oh, is this somebody who's already commented?
Yeah.
Yes, I see that. On a different topic, I suppose.
So yeah, if this, Juliet, if this is a comment on a different topic, you can comment again now. If not, you can comment again at the end of the meeting. So keep your hand raised if this is on a different topic. Okay. Oh.
Okay, Julia, I will allow you to speak. Please unmute yourself.
Yes, sorry, because I remember I didn't have my full name up. It's Juliet Carbajal. It looks like, yeah, you spelled it right. So that was my addition, and I just wanted to underscore, maybe I talked too fast. I didn't have the transcript up, that how we really need to work together, you know, from the bottom up, who are the grassroots to the town manager and beyond. And that's what I wanted to say, my name, basically. Thank you.
Great, thank you. And there had been a hand that went down, and I just want to make sure that person didn't want to speak. Yeah, there they are again.
Okay, Jennifer Healy, I will allow you to speak. Please unmute yourself.
Can you hear me?
Yes.
Okay. I wanted to call and talk and just follow up on what everybody's been saying on Kratom. I am from Easton, Massachusetts, and I have watched people go through addiction, and I have seen the tremendous value that Kratom can possibly do for harm reduction going down that road. As well as do believe that Kratom is an extremely good plant and can be used for chronic pain patients. Right now, we're facing in the chronic pain world not only a reduction of the ability to get our medication that we need, but flat out discrimination against some of the medication that certain people need to just survive, to get through another day of life. And I guess it's a shame to me to hear that we would be looking at taking away a natural plant that has shown tremendous relief to so many people and think that that's okay. Whereas I believe every single person should have a right to put a supplement into their body as long as they're educated, they're over the age of 21, and they know what's going on. I think we do have a problem with the synthetic that's out there. I do think it should be banned, but I think you need to realize that this kratom is a lifeline for some people. And you're going to be taking away a lifeline for many, 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 many people. And it's only going to make things worse. If we're worried about things getting out on the black market and people buying things off the street, this is a great way to do it. You go through prohibition and then everything goes underground and then people start dying all over the place. So I guess I just wanted to support today the fellow kratom advocates that are out there and say how much I really would appreciate if you would consider at least leaving the whole leaf kratom as legal and not something that has to be banned. So I thank you for your time.
Thank you. All right, maybe third time's a charm. I don't see any more hands, so I am going to close the comments. Okay, for real this time. All right, so the next, thank you for all of those comments. The next section is on kratom. So Kiko, maybe, I don't know if we want to start with the draft regulations or if we want to start with the sort of research that I did one, you and your team have done several, and maybe summarize what you found there.
Yeah, I think it makes sense to start with the research.
Okay.
So at the end of the meeting, we really thought what would be most important would be to go out and see what's on the shelves here and to talk with people about, which is what we did at Wildside Smoke Shop. I had a very long conversation with a staff person there. But to your point, Betsy, I can share this document. So we put together a summary document that has photos in it. Do you want me to share that? And then also share the pictures that Laura attached to her email as we get into this conversation?
I think maybe not sharing the text, but the pictures.
Okay.
We can speak to the text, but.
Okay. So let me see if I can share this. Hang on a second. Are you able to see this?
Yes.
Okay, so these are John Daly kratom beverages that were on sale at the Cumberland Farms near Fort River. And I think these are small beverages, is that right? They're not big cans, Risha?
Oh yeah, you can see the Twizzlers as a comparator.
That was
they're
the
quite
size
small.
comparators. Got it.
Okay.
Okay.
That's not why it's there. That's just where the Twizzlers were on the counter.
I thought that was very proactive of you if you did that on purpose. And then my question would be, are these behind the counter and you have to ask for them, or are they grab and go?
So they're not grab and go. This is, you can see, you could grab the Twizzlers. They are on the counter within arm's reach, but that is not an open case. It can only be taken out from the back, and that's what's facing the cashier. So a person at the counter can't grab from the front of that box.
I see.
But it is straight on the counter right at the cash register.
And was there any signage to the effect that it's only for purchases 21 and over? No.
No.
Okay. Okay, so I'm going to stop sharing for a second.
I see a hand from Betsy.
Question. So that doesn't look like a natural leaf. That's a beverage, so there's some processing.
Yeah,
okay. Do you know? Because I don't know. I took the picture. I was there, but I did not. I was surprised at how expensive it was. I didn't feel like buying it, so I didn't actually look at the.
Because I think part of our question was, what's out there in our community? Are we seeing the natural leaf products, or are we seeing?
I had assumed that was synthetic, but now I'm not entirely sure based on the other stuff Kiko has come up with.
Yeah, so maybe the high level summary is that we're seeing a combination of these things on the shelves. So in gas stations, I went to a few gas stations. I found a few gas stations that didn't have any of these products. Risha and I found a few gas stations that did have these products, and the products that we found, like this other one, let me just show you this because this one I understand from the young people that work in our office is a particularly popular one, this Feel Free. There's a lot of social media following on this particular product, which has kratom and kava in it together, and then anecdotally is quite addictive. So this I saw in a couple of places, gas station, convenience stores. That is a synthetic product, a 7-OH synthetics product. I imagine that the beverage that you saw, Risha, also is a synthetic product, but I don't know for sure. But they all seem to have the same look and feel. They're small bottles. They have names like Feel Free or whatever else. This is what we're learning from the people who are knowledgeable about this. And so that isn't most likely a 7-OH product. So what I'm seeing is that in the convenience stores, it's 7-OH products. Grab and go, snazzy advertising. And then in terms of the 21 plus, some people are enforcing that or having signage to that effect, and other people are not. So it's inconsistent.
Is that a regulation? Is there regulation that it has to be 21 plus?
I don't think it's a regulation. I don't know for certain.
No,
good question. I think it's just the way some people are choosing to market it because it's a substance that has some controversy surrounding it. But
yeah, I think part of the problem
at this point.
Yeah, I don't think there's any regulation. I had asked some neighborhood kids to go buy some. I was not able to convince parents to let them because I wanted to check if they actually are just by themselves, but there is no regulation as such. I just want to state that I do see that there's a hand in, and for this part of the meeting until the end of the meeting where we have another open comment section, we can't take comments. So apologies for that. Betsy, I see a hand again.
So again, I thought our question was, whether the natural leaf product was something that was out on the shelves and restricting it would be a takeaway. And I guess I'm not sure of the answer to that.
Well, I didn't get to finish. Let me finish, and then I can answer that. So as I was saying, what I noticed in convenience stores is 7-OH products with this sort of marketed in this way. I went to two adult-only smoke shops that we have in our town, Wildside Smoke Shop and Lazy Lungs. Both of them had natural leaf kratom powder on the shelves. I can show you a picture of what I found. Hang on just a second. Just a moment. This is there, and there are many different brands, but this is what I found at Wildside. And there were many different iterations of this particular brand of kratom leaf powder. So with different sorts of names like Relax and Chill or some other kinds of branding, but the packaging all pretty much looks the same, just slightly different color, and they're different dosages and different amounts. And you can get it either in capsules where the leaf powder is in the capsule, or you can get a bag just with the powder in it. So that's kratom leaf powder, which I only saw in those two places, those adult smoke shops. Most of the merchandise that you see in those places are glassware, bongs, pipes, things like that, and drinks and other things. Some of these CBD products that are covered by the Northampton regulation, where they say all novel intoxicating products, which include some of these CBD drinks that are all through the loophole in the Farm Bill, that allows them to be sold in places that are not cannabis dispensaries. They have things like that on their shelves. They have a lot of mushroom products, gummies and things that have non-psilocybin mushrooms in them. Again, an unregulated product. There's a lot of stuff out there. But to get back to the main point, yes, there is kratom leaf powder for sale in our communities, but I only saw it in these two places. Now, I didn't go to absolutely every store, so it may be somewhere else, but that wasn't the pattern that we were seeing in the more than the half of the stores that we visited. And then in my conversations, and I'll just finish this and then I'll let you all discuss, conversation with the employee at Wildside, who was very well informed, very intelligent, very conversational, very accessible. Had a lot to say about people who come in to buy these products, veterans, people with chronic pain, people with PTSD, folks who are really using it, as you've heard from many kratom advocates who come to these meetings for chronic pain when other things aren't working. And he is somebody who answered questions really well, did not have an agenda about pushing a product, was really clear that they don't sell these products to anybody who's not over 21. That's their own internal rule. And was answered all of my questions about what they knew about where these products came from. Now, I think they only can get the information that the merchant that they're purchasing these things provides. I don't know that there's great external testing of products. I think some of the advocates could tell you that there are some products that are rated as better than others. There's a website where you can go to look at kratom products that might be less likely to have additives or contaminants or other things. You know, some vendors are more reputable than others, things like that. But my main takeaway from the conversation with the person at Wildside was that he does a lot of education with people who come into the shop about kratom and kratom products. They do also have the 7-OH stuff there. He talked about how he didn't favor that, and he understands that there's a move to ban that, and that he's seen more people have issues, addiction issues with those products, but he didn't have anything negative to say about the kratom leaf powder. So that was just my experience in talking with him. So I'll leave it there.
Any comments or questions from our board members? Betsy?
Two questions. One is, did you get a sense of how much the sales of the natural leaf powder are? You know, what the ratio of sales are? Is this 10% of the market, the bulk of the market? You know, they see a couple people a week, they see a dozen people a week. You know, is this a frequently sold product at the shop?
Yeah, I did tell him I was from the public health department and they were considering a ban on the product. So, and he was aware that they've been banned in other places. And I did ask, you know, what's the main thing that you sell here? What's the main source of income for you all? And he said it's the glassware. That's where they make most of their money, in that shop. But I didn't ask him that specific question. Are they selling more of the leaf powder than, say, the 7-OH small beverages or pills that were there? But they certainly had a more extensive supply of kratom leaf powder. It took up a much bigger, you know, square footage on the shelves than the other things, partially because they're bigger packages, but also because it seemed like there was more of it that turns over of that stuff than the 7-OH stuff. But I didn't ask that specific question. It would have been a good thing to ask.
I think the other question I have is there was a lot of discussion about the whole leaf being the safe product. What I don't know is whether there's a dosing effect that when something is made into a powder, it's easier to get to significant concentrations, and whether that, you know, provides any increased risk. I just don't remember when we were doing our dive into that, whether, you know, no one was saying the natural leaf powder was fine. We were hearing that the natural leaf, and if you see the leaves, you know, that's a safe product.
Yeah, I asked that specific question of Laura Romney in an email that was sent to all of you, again, just a couple hours before the meeting, so you may not have had a chance to look at it, because I had that same question, Betsy. And I don't have it right in front of me, but what I remember her saying is that the leaf powder is a lot easier for people because you can mix it into a smoothie, you can pop a capsule. It is a little bit more concentrated. The tea, if you brew a tea, is by nature going to be a little more dilute, so probably more higher dosage from the capsules. But if the packaging tells you how much is in there, and so you can calibrate how much you're taking into your system. It's like easier to eat, has a less strong taste. Some people don't object to the taste of the tea, and that's why the capsule, if you just swallow it or mix it in with, chocolate milk or something, you can't taste it. So, but to summarize, the kratom leaf powder is considered natural leaf kratom. It's just in a different form and possibly could have higher dosage. I think that's something that the advocates could give more info about, and that's something that proper labeling would need to be very, would be important.
I don't know whether this is a fair question, but is it okay to ask whether these advocates are paid advocates versus people who have a lived experience?
I believe we've asked that question before, and people have said that they are not paid. The people who chimed in at these meetings are not paid advocates. They are users sharing their personal experience.
Sorry, Pramila? You're on mute.
I do have Kiko's correspondence with Laura Romney up in front of me. And what I'm concerned about is Laura saying the powder and the capsules are typically natural kratom. I say typically because there could be some that are 7-OH infused. And then she goes on to say 7-OH and other synthetics are typically in pressed tablet format. But that is typical, not always. And that's the piece that concerns me. How we're going to regulate, well, that's an overall question, really, how we're going to regulate and ensure that natural leaf kratom is the only product that's sold. And who's going to enforce that?
Can you say more about the enforcement? What's your, because there's various parts of that. So I just want to see which part you're.
Fair enough. But well, that's something we also talked about before in our last meeting about enforcement, and it would not be our inspectors, our regular inspectors that do that, right, Kiko?
I think we'd have to figure that out. Because our regular inspectors probably wouldn't have the bandwidth to do this. We could ask, we could talk about it, but there isn't a ready infrastructure that could go and do this right tomorrow. We'd have to plan something.
Yeah. So, my question, my concern also is it's not just what products do you have? You have to look at the product to see what it contains, which to me, means that there's more to it. It's not straightforward. The other thing I would say, and you can take this for what it's worth, it's interesting to me that there's nobody local who's spoken up about this. And there's never been anybody local who's spoken up about this.
Yeah, I wondered about that too, because when I went to Wildside, I really got the impression that there were people who live locally who come and get kratom leaf from that shop not infrequently. And so I don't know that those are people, though, that are tuned into public meetings that the town of Amherst is holding. Even if we advertise them through, it's just, we might not be reaching those folks. And the people who do show up are people who've really taken an advocacy role and have made it, an important part of their lives to be talking about this. And there may be many users in the area who just don't fall into that role, so they're not coming to this meeting. So, I guess that was one thing I thought about after talking with the Wildside folks, is if you really want to hear from people in your community, maybe we should put signs in the places where kratom is sold and say, hey, we're thinking about regulating this. Come and tell us what your thoughts are about that.
Mm-hmm. Yeah, and I see multiple hands up, so I just want to remind everyone that we cannot call on attendees versus panelists at this point in the meeting. Yeah. So I think I entered I entered this conversation 3 hours ago before that last bits of information came in from you guys, thinking, you know, it was pretty clear what synthetic was and what non-synthetic was, and that it would be pretty easy to draft a regulation with that. I found what you submitted and what you found actually more complicated. I think it's harder to tell. And the responses to those questions for me raised questions around the problem with these products is they aren't in any chain of command, as it were, right? They're not regulated pharmaceuticals, so that they're not food products. They're not any of those things, and therefore, who is testing that what they say isn't in them is actually what is in them? And I think the answer is nobody right now. Is that true, Kiko? Have I misunderstood how things work?
I think the only thing, as you heard from folks making comments, is that the FDA is planning to schedule 7OH, schedule it, meaning that it would be a schedule whatever substance that would be, regulated that way. Yes. But other than that, no.
And for the moment, that isn't there yet. And so I have a real empathy for folks who would like to keep access to the natural leaf product. And yet how do we ensure that is a question in my mind. I think for me, there is an urgency about at least making everything 21 plus. I find it really frightening that I could send 10-year-olds from my neighborhood to buy it and that there's nothing legally restricting that. And that they are on the counter. They look like energy capsules. That I feel like there should be at a minimum a 21 across the board on all these products. And I would love to not postpone it another month. Even, sort of the not let the perfect become the obstacle to moving forward. So that's sort of where I'm at right now.
So to make sure I understand, maybe others understood, does that mean you would propose a regulation that says just that any of these products can only be purchased by people 21 and over?
I would, if it were, my vote is at this moment, can still change my mind after you guys comment, but would be that the synthetic is banned altogether. If there's a way to do that in the same sort of language that Northampton originally had around synthetically altered cannabinoids and kratom, that feels great because it does. There's also holes, gaps in the regulation of non-kratom products, and that we would put a 21 plus on natural kratom products, and then if we again want to go and learn more, have more conversations, specifically ask Amherst users to come in and be part of this conversation with us. And, if we want to sort of hold back the ability to further regulate the natural product, but my urgency is around at least getting it 21 plus.
I see.
Well, and my urgency would be getting the synthetic regulated against, for sure. I guess for me, and I have absolutely no interest in preventing access to anybody who genuinely finds this helpful. My issue is the safety of the product in the absence of regulation. And again, how we're going to be able, or the inspectors are going to be able, how reasonable is it for them I'm assuming if we say over 21, theoretically, it could be sold in shops other than Lazy Lungs and Wildside, right?
Unless we put that, yeah.
Only sold to people who are above 21.
I mean, I guess that's another option for the board is
Yeah.
you could say that you'd restricted sale only to stores, adult only
To
stores.
adult only
They're the
stores,
only
yeah.
ones who can carry it.
That would make me feel better about limiting access to the product.
They are, as far as we know, they are the only ones carrying the natural product now. So it's not, to our knowledge, taking it off the shelf from any other current retailer.
Yeah, I think that's right. I did speak to somebody at Amherst Market on Triangle Street. I asked if they had Kratom products. He said, I'm out of them right now. I said, what do you carry? He said the powder. So I don't know if that's the pressed powder, synthetic powder, or if it's the natural leaf powder. I'm not sure. So it's possible that it could be on shelves elsewhere because we didn't hit every single store, but it seems like it's not a big part of the, whatever
the
the word is.
convenience store market right now.
Yeah. Or their inventory. It's not a big
but
part of their
nevertheless, the fact that it's accessible theoretically and in some cases practically when he does have a supply, it is, I mean, even if you sell to someone, even if you only sell to someone who's 21, there's no guarantee, right? Without examining the product, the contents as stated on the package, what exactly they're getting. That concerns me.
I'm going to reiterate what I think you're saying, Pramila, and correct me if I have it slightly off. Part of the concern here is your concern here around the fact that there is no standards on labeling. And therefore they can say it's natural and none of us, the inspectors, the vendor, the retailers, the users would know different. Or is it that if we take the labeling at face value, that it requires a bit of a higher level of analysis from both the retailer and the consumer to understand what that they're looking for, not 7-OH.
And that purpose could be served by, I mean, what you first said, it's true. That is my concern.
Okay.
But if you at least at minimum limit it to where you can get it, that sort of reduces accessibility.
Well, it takes, I mean, again, since we know, I mean, I'm sort of blown away that the answer to this is here's a list of folks that we think sell good product. Because my goodness, that's nobody has clinically trialed. It's as a user, that would be a very hard thing to know, and as a retailer. And so I think, taking that, limiting it to stores who sort of specialize more in this stuff, who seem to have knowledgeable buyers, sellers, feels like a much safer way versus, someone who owns a gas station who sees a demand and goes to fill it, maybe with all good intentions of it being the proper product, the proper natural product, but isn't informed enough to know how to look for those various things.
And we are making an assumption because the person at Wildside was very knowledgeable. That isn't necessarily true of the other smoke shop in town. I'm not saying that. I mean, it seems to me that that is at least some containing of the issue, but not a guarantee in relation to safety at all.
So I think what I'm hearing, and Jack hasn't said anything, so feel free to jump in, but I think what I'm hearing is an overall desire to keep natural kratom available. Sorry, I just realized, Pramila, we're pronouncing it wrong again. Kratom, keep it available to people who are finding benefit of it and using it safely. However, we are hampered by the fact that because there's no regulation, it is very hard to safely do that and take off what we all have sort of agreed is an extremely harmful product. And so I think we're trying to find the balance until better regulation comes that can guarantee us that what it says on the product is actually what it is on the product. A way of keeping access available to people in the safest way possible. And that might be a 21 plus, that might be an adults only store in addition to a 21 plus. I don't know if there's other ways that people have thought of to sort of balance that desire.
So, I find I struggle with this because I'm not that familiar with the product. I have heard of it. But I'm just kind of shocked that there's nothing from the state or federal level on this. And I think, Pamela's point about just the things on the packaging can just be fictitious, which is concerning. So I'm really kind of confused that this kind of thing exists, and is out there, and it can be dangerous. But I'm very interested in looking at the South Hadley regs. I know I don't have the Northampton ones in front of me, but for me, I would like to go over those. But I'm not sure what you think we can get done today.
Yeah.
I mean, do you want to like pull things off the shelf until we get it resolved, like in a month or two or something? Or
There's always going to be new stuff.
Yeah.
I think, I mean, it seems to me the synthetics are the crucial, that it would behoove us not to delay regulating that. And
Yeah.
And I would be in favor of the natural only being available at adult only stores until further notice. I don't know I'm sure there are many, many good actors whose products who have what they say they have, but that's not everybody, and that's not commerce. And therefore, our job is to be vigilant on behalf of the public. And so anyway, I think to me, it seems an interim measure of banning the synthetic and other synthetically derived products, and then restricting this to adult-only establishments and keeping it under advisement. I mean, I would love to have something posted in the adult-only establishments saying, let us hear from you. So that we're more informed.
Betsy, you had a hand earlier. You're still on mute.
You muted yourself again. There you go.
So I agree with, I think, the drift of what Premila is saying, that it's really important to regulate the synthetic, but the difficulty is knowing what's synthetic and what's not synthetic. I find myself really troubled by this idea of powder. If 2% is the threshold of what's considered okay, and you have powder that can, easily get to a concentration twice or 3 times what you get from a leaf being brewed. I guess I'd like to see compelling evidence. No one was talking in the research that we did, that I recall, about the powder as a safe form that's under that 2% threshold. It seems that it's pretty hard to regulate something that doesn't have a house where that regulation there's some responsibility and ability to oversee that. It does seem like limiting things to the adult only and smoke shops where people are more knowledgeable and also have this as a significant part of their business. And so the enforcement of the regulations, something that's important to people, it's an area of their business they're really attached to. I think that's an improvement over having it in convenience stores and gas stations where there isn't the same investment in doing it. So I think that that's a good interim step, but I feel like I just don't remember seeing anything about the powder being something that says natural powder being something that is reliably considered safe.
Yeah, and I guess I would just say on enforcement, I think the fact that we don't have staff that are, that we are aware of that have time to add this on shouldn't stop us from passing the regulation. And I say that because what might end up being the enforcement mechanism here is people reporting it. So concerned parents, concerned others, seeing something, if we pass something, it would go out in the newspapers. Hopefully there'd be more awareness around it. I think I'm starting to see more on social media and other areas about it. So I think it is people are becoming more aware of it. And so they might, call the health department and say, hey, I saw this, it's not supposed to be there. And that would be rather than having people regularly go out to all places that might possibly, because the problem with the regulation is that we only inspect the places that have licenses for tobacco. And so all those other places that possibly, because right now anyone could sell it, we wouldn't have the mandate or the manpower to sort of have that done routinely. But I think it's okay. Sorry, that was a long way of saying that.
I will say, I mean, I think if I'm understanding you correctly, Betsy, your concern about the powder also is someone using more of it, a greater concentration of it, right, than what's recommended. And I remember in the Northampton regulations before they did a complete ban, there was a section where you had to hand out pamphlets. The people who sold them had to hand out pamphlets about how to use this and so on. And that seems to me to be, I'm not sure where the pamphlets would come from, but that seems to me also a reasonable measure. I would still advocate at least restricting it to adult only establishment.
I think if you weren't restricting it, the ability to having a meaningful educational experience in a convenience store with a high school student who's doing some after school work and is doing a lot of other things, but educating about safe use of kratom would be a lift.
Yeah, no, I'm talking about having the education happen in the adult only establishments, because that would provide an added measure of protection.
Right.
Yeah.
So Kiko, could we vote on banning all synthetically altered cannabinoids and kratom sales in Amherst and restricting natural kratom product sales to 21 and older and in adult only venues or retailers? I know that's not exactly how you've written up the draft, but could we make that vote? And it's not really fair for me to be asking you. I should know the answer as well. But then, we each read the draft as it comes. Do we have to have another meeting I guess we'd have to have another meeting if there are any changes, right?
Yeah, I think that we're talking about adding in some language. Maybe, did you say, Premila, that you wanted to add in some language about educational material
Well,
being distributed?
I think that would be, yes.
That
If
because
you look at the Northampton regulations that you
right,
included, it specifically says pamphlets.
yeah,
And so, you know, again, to me, that is an added safeguard, not foolproof, but an added safeguard.
right. So normally with this kinds of conversations, what we've done in the past is you all have said, okay, this is what we have this draft of the regulations. We like it, but we want to take this out. We want to put this in. We want to add this sentence. So that's essentially what you're doing. You're saying, because we presented you two versions of the regulations, the ones that we thought we were going to vote on that had, you know, that are basically the copy of Northampton's that say banning everything. And then we're kind of revisiting it. So we sent you the old Northampton regulations that had that language about natural kratom leaf is exempted and it can only be sold to 21 and over, and you have to have educational material. So I think what we'd want to hear, if you all can decide, we want these regulations to say banning synthetic kratom, okay to sell to over 21 or adult only stores. It's one or the other. I think you have to decide, because otherwise,
Okay.
right? I think you have to decide that. And then do you want to put that language in about educational material? And then the other thing that I think is in the Northampton reg is about the label should have certain things on it. And I think that this is going to be a little bit of a test, right? We do this first iteration and then we see what it's like to enforce with those guidelines. I mean, Northampton decided that's going to be too fussy. We don't want to do it. That's why we're banning everything. There's certainly a school of thought that says, don't do that because people need access to natural leaf kratom. Try to regulate it in this way according to the labeling, which I think we can do our best job of. And especially if it's only being sold in 2 stores, that'll make it easier on people who have to look at the
fairness
products.
to Northampton, I want to say that it sounded to me like most of what guided their decision to make it a complete ban is nobody was selling it, that in their area of jurisdiction, nobody was selling natural leaf kratom. That's what was said at the meeting.
I remember, you're right, and thank you for that. And I'm surprised by that because I wonder if what they meant was nobody was selling the tea, the actual whole leaf kratom, because that I didn't see, but I certainly saw the powder, lots of it at Wildside, and I would be surprised if it's the only place in the area that has the powder. I think they were lumping the powder in as something that wasn't this natural whole leaf kratom to me.
I mean, their regulations exempted the old version, exempted raw, unaltered kratom leaf or powder.
Or powder. Okay. I mean,
well, I'm just saying that as a,
yeah,
it wasn't a
you're right.
question of convenience necessarily. But yeah, I mean, I think if we can get that done today, then that would be helpful. And again, the second piece, the natural leaf is, you know, again, as Kiko said, you see how it goes. And, you know, I'm assuming we can make an addendum if we need to.
Yeah. And we have a model. I mean, we can look at what South Hadley's, how they've worded it. Springfield has also done something similar. So, you know, people are taking different approaches to this.
I couldn't find South Hadley, so I don't think it's publicly available yet.
I think you're right. It sounds like it was just 2 weeks ago that this happened. I wasn't aware of that. So yeah, can look into that.
I will just say I'm not a fan of the educational material. For what it's worth. I mean, it doesn't feel like the biggest part of this. So, but my sense is we could certainly give them, but we would have to come up with it. It says, you know, the way Northampton has it is the Department of Health approved. I see, I guess to me, that would be maybe a thing to add on in the future if we feel like the dosage is, because I hear Betsy's concern and I share that. I don't think we're going to find research one way or the other on it because part of the issue is there just hasn't been a lot. But yeah.
Numbers. I just wish I had seen some of the data saying I remember seeing the research on the leaf, but I don't remember seeing anything about the powder. And that this is, it's already, there's an extraction product. It's not like they're just crushing whole leaves and making it into a fine powder, right there.
But
Yeah.
it seems to me the bottom line, though, is regardless of the process, there's no regulation of it, right? So anyone could theoretically say anything and sell it as powder. But at least if there's limited access, that provides some safety measures.
Let me just conclude my thought on the educational materials. I find policy regulations around educational materials really difficult to adhere to as the person adhering to policies. And I can imagine the immense eye rolls the third time you hand it to the same buyer and are like, I have to do this. And I would not feel great about levying a penalty on someone who's doing everything right but didn't hand a flyer that time. It just doesn't feel like the piece that I'm super motivated to be worried about. Having said that, again, it's not the make or break for me. Let me let anyone comment on that, and then I have one more question on the Northampton ones. Does anyone feel strongly about the pamphlets and education material?
Well, I mean, to me, again, it's like we know one store has well-informed staff. Is that staff member there all the time? Who's there and who's there at the other store? Who's going to guide them in terms of how to use it? And if there's something that's printed, there's something you can give to people that provides some guidance. That's where I'm coming from, because it's very hard to guarantee appropriate counseling.
Sure. I just looked at the time and realized we really need to move on. Are we at a place where we can take a vote on, well, let's start with the relatively easier bits of this. Are we in agreement that we want to completely ban the sale of synthetically altered cannabinoids and kratom?
Yes.
Jack? Yeah, okay. Okay. Are we in agreement that we want to limit sales of natural kratom, and we can use the official raw unadulterated leaf or powder to adult-only stores?
Yes.
Okay. There is a question on the educational materials, whether that's a optional or mandated thing. I think Pramila and I have both weighed in. Betsy and Jack, anyone have opinions there? Will retailers be required to give out educational materials so that we can mitigate, so we can be very clear that there are the labeling problems, that they're not tested, and dosage recommendations?
And why were you not, why did you question that as being?
I find it difficult to regulate handing out materials.
I see.
Right. I mean, the thing is, we could develop some materials, including asking people to give us feedback at the health department about if they have questions about kratom or if had a difficulty, but we wouldn't put it in the regulation. So it wouldn't be something that we'd have to regulate, enforce, track. It could just be something that the health department develops and gives to the stores for them to hand out if they want, instead of being something that you're going to find people on, like you were saying earlier, Risha, if they don't hand it out. Like, that seems not something that you'd want to do.
Yeah, that seems like a reasonable compromise.
So then there's no wording about it in the regs, but it's something that we can develop. Does that sound right?
And I think we should develop it. I think that this is a place that people need to have more education on. Can Kiko, you mentioned that there was something about labeling in the old Northampton regs, and I couldn't find that. Or maybe I thought it was Kiko. Maybe somebody mentioned a labeling section that I was not able to find. So I'm not sure what that is in reference to. Maybe it's in the new ones.
I thought it was in the older one. Trying to remember. I'm looking.
Okay. Betsy.
Yeah, I'm still a little confused. I was going online trying to see whether everything that's called a kratom powder is the natural, like, does it have to say natural kratom powder? What is the exact wording of what we're allowing?
I think it's that it doesn't say 7-OH.
Yeah.
There was the 2% is, so it's not that the powder doesn't have any of the
7-hydroxy.
Or the mitragynine, or whatever it's called.
or the mitragynine. So I think we have to be more specific than that. I don't think that's adequate.
So the description in the old Northampton regulation says that raw, this is what's exempt, is raw unaltered kratom leaf or powder. I think you read this, with no synthetic additives, provided it's properly labeled with a full list of ingredients clearly displayed on the package. Serving size and dosing recommendations are included and does not violate state or federal law.
That's the powders that are available and see whether those actually would fall under that guidance. Does that accurately capture?
But does it really? I guess I would ask Betsy if that matters. If we feel that that is what is the minimum that should be on the powder, then that's what it should be. And if the product doesn't meet those standards, then they'll have to find another product that does.
Well, if that isn't on the products that they're selling, then we don't have a problem of, it goes back to the same thing, that this isn't something that fits under what we're trying to allow. So are there products that are labeled in a way that we would allow them under these regulations?
Yeah, my understanding of what's considered the proper labeling for these products would be that it has dosing, and it says that it's just kratom. There are no additives. So it's under ingredients, it would say full leaf, powder from whole leaf kratom or something like that without anything else. The 7-OH products have other things listed as ingredients. And then it would have dosing instructions. If it doesn't have the actual ingredients, it would have a reference to a website or batch info where you could find the information about the ingredients that are in that particular package. And it should also have the required FDA language about how this supplement has been not been evaluated by the FDA for safety. Any supplement that you buy has that language on it. So this should also have that language if it's properly labeled.
And do we know whether the products that were in that store fit under that guidance?
I didn't look.
Because I think we need to, because if we're making a big thing to make sure that something that's currently available stays available, but actually what's available wouldn't pass this test.
I think this is part of why Northampton found this a bit overwhelming, because it might mean that we would go into Wildside and say, okay, you're selling leaf powder, but it actually doesn't meet these labeling requirements that we now have in our, and so you have to take this product away and buy this one instead. Here's the list of products that are approved that have these criteria, proper labeling, possibly.
Or they'd have
I
to
would advocate for having the least amount of specificity at this point. So saying raw, unadulterated kratom powder or leaf.
Full stop.
Full stop. And learn over the next coming months what we can and should add to that as clarity. Because I don't want to not do anything now because we don't have the perfect information.
Mm-hmm.
And I don't want to do what you're worried about, Betsy, which is ban things we didn't mean to ban and get ourselves in a bit of a pickle.
Well, actually, what wasn't going there, I was thinking maybe everything that's on the shelves would fit into the things we were going to ban, because in fact, it's not going to be labeled as just natural crushed leaf, because I'm not sure how you get to a powder without having, I mean, I don't know, but I just don't know that the things that are out there would actually meet these requirements. And if we don't have products that are in our community that meet these requirements, we don't have to, it's a different and simpler ban.
Okay. How do we feel about the language around raw, unadulterated kratom leaf or powder, period, as the thing that is allowed to be sold in 21 plus stores, adult only stores? Okay.
I'm happy with that.
So can we get a
We
motion?
can amend it as needed as we gain more information. Okay, yeah.
Yeah. Can we get a motion to, let me try to say this, amend the draft regulations to ban all synthetically altered cannabinoids and kratom from sale in Amherst, and allow raw, unadulterated kratom leaf or powder in adult only stores. Can we get a motion?
So moved.
So moved, yes.
All right, I'll take Pamela as a second. All those in favor? Jack, are you in favor?
Aye.
Yeah,
yep.
Great. Okay. I do think we have a lot of work to still be done on this. I would like to take Kiko's idea and actually put signs in those stores and ask for people to come to future meetings and tell us what they think about kratom, and I think have further discussions with the store owners to understand what reasonable labeling is, and what we can do there. And I'm sure we will continue to hear from the public at large as to how close we're getting on this. All right, we have a lot of other business that we're going to have to fly through. So Kiko, the next on the agenda is the well.
Yeah, and this is fairly straightforward. So folks remember that the board approved the geothermal well project at Amherst College. There are multiple wells that have been dug there. It went through it's just the project ended up taking longer than expected. So the permit ran out and they have to reapply. So we can promote Chris Tate from the waiting room, Maheen, if you could do that, who can give a little bit more info and answer questions. Chris, are you there?
Yes, I am. Thanks, everyone.
Want to give a quick summary since we're running so behind here?
Yeah, I can do a very quick summary. The original well permit, well 24/7, was granted in October 24, and you guys extended that permit for us in October of 25, but now it expires in April of 26. So we're just trying to continue the same exact work from that original permit, but to get us through the summer. So that's 51 bores remaining out of the 141 that had been previously approved. And none of the other details with the project have changed. We'll still use Laframboise well drilling for the work. We just sent them home for the winter because that winter work is very slow and painful. So the plan is to get everything done over the summer, and then we'll repave the remaining section of the parking lot. So that's the very quick version. And I'm happy I could talk for hours, so just let me know what you need.
What is the end date of the extension you're requesting?
Well, I would be fine with the year-long permit that, you would get anyway, but I'm hoping the end date will be August of 26. That's the goal.
Okay. If we extended this one, it would be April of 27. Is that?
Yeah, because they're usually a year-long permit, is my understanding.
All right. Any questions from the board? Okay. Anyone want to make a motion to approve? Betsy makes a motion to approve.
Second.
Great. Jack seconds. I'm glad to hear your voice because I know I want your opinion on this one. And all those in favor, either say aye or raise your hand. Jack, we need an aye from you. Jack, if you can hear us, we need you to vote on this.
Yeah, do you hear me?
Now we do. Yep.
You
Is
hear
that
me?
an aye from you?
Yes, I. Yeah.
Okay.
I'm sorry.
Great. No problem. I understand you're in the middle of traveling now.
Yeah.
All right. It is passed, Chris.
Okay. Thank you very much for your time. I appreciate it.
Thank you. Sorry for the long wait that you had.
That's okay. I know much more about Kratom now than I did before.
All right. The next agenda item is the request for variance on body art regulations. Kiko, you're going to give us an intro to this?
Yes, I'll give a brief intro. So this is also fairly straightforward. So this group worked on the body art regulations. They were revised, really within the last year or so, year and a half. And there have been some practitioners who've been working in apprenticeship roles at our one and only body art establishment here in Amherst before some of the new provisions that we wrote, that you all wrote in about hours that were required for apprentices and other things. And so essentially the requirement for somebody to complete an apprenticeship and then be able to be licensed as a full practitioner is that they have, and this is on page 25 of the body art regulations, which were sent to you again for your reference, 2,400 hours working with a trainer tattoo artist, 200 hours of documented procedure observation, and 100 tattoos performed under trainer supervision. And there's an addendum to the regulations with a log that we, not required, but recommended that people use to document these hours. These regulations with that addendum were issued after this particular person had already been apprenticed for a couple of years. So the bottom line is they don't have the logs to show this. But the letter that you received, which again, I apologize, was sent to you only this afternoon from Stephen Lambert, who's the owner of Wanderlust Tattoo, lines out the amount of experience that this person, Cameron, who's been with them now for a couple years, not 3, but a couple, has done. And it's more than he's working there full time. So he's exceeded the number of hours. So you can review that letter and look. And Stephen is actually here with us, so we can also promote him to panelists and have him weigh in about the situation. Hopefully I've captured it reasonably well. Stephen, please go ahead. You need to unmute yourself. There you go.
Yeah, okay. So, all right. I've had Cameron working for me for about 2 years. Before that, he worked in Connecticut for a year, right? So if you just do the simple calculation as to how much time he's worked for me, it's well over the 24 hours that was requested. And as far as logs go, I had him tattoo for a year for free on his friends and family. So you asked for how many procedures to be done beforehand? Does anybody recall?
Oh, I can look. 100 tattoos performed under trainer supervision.
Sorry, I was muted.
So he has he did over 200 free tattoos in that first year, and then I've had him tattooing now for another year after that, under my supervision and Daniel's supervision as well.
So this seems like a reasonable, what's the word I'm looking for? I mean, I know it's a variance, but a reasonable substitution for the documentation that we were asking for. Does anyone have any questions?
Is it possible to get, I read Susan's letter, which asked for documentation from the establishment in Connecticut that he worked for. Is that a reasonable option or no?
The establishment has been closed for about a year or two, and the man has moved.
Okay.
So, but going with the regulations that you've already that have already been put in place, like he's far exceeded the 2,400 hours. So like, wouldn't that circumvent the need for that documentation?
Mm-hmm. Mm-hmm.
Because it would be
I mean,
about the amount of time like put in. So if like the man has been apprenticing for 2 full years here and exceeded those hours and exceeded the amount of time that like he one needs to shadow and two needs to like do the work, as well as having like all the other certifications that were asked for, would then like asking for him to get somebody else who's like moved on just be like above and beyond?
Well, it's not a reasonable request, obviously, if the outfit is closed and
Yeah.
the person has moved out. Yeah.
Yeah, I mean, he did have like a notarized, something notarized, like saying that like he was an apprentice there.
Fair enough.
Do we have, or could we have just a note on the file stating that he has done well over 100 procedures and well over 2,400 hours with your signature? Is that part of the packet already, or could it be?
Yeah, no, it is.
Yeah, that's the email that was sent today. I don't know that it's signed, but we can certainly, I mean,
it was signed.
It was signed. Okay,
Okay.
great. Thanks.
Okay.
Yeah, perfect.
So I'm happy with using that as a variance. Can I ask how this affects next year's application? Like once we do it, is it done? Or yeah, how do we handle making sure that it doesn't come up every time?
Yeah, so he would be licensed then as a full practitioner, and then he's now a full practitioner from here on in. Yep.
Okay. Any other concerns from anybody else? Sorry, I'm rushing these through because we got so far behind. I know there's still more to come. Would someone like to make a motion to approve this variance? Betsy?
Moved.
And a second?
I second.
Pramila seconds. All those in favor, say aye or raise hand.
Aye.
Thank you, Jack. It is unanimously approved. And thank you for your time. Stephen, if you, maybe this isn't the time, but I'd also be really interested if you've had any other experiences with those regulations that you have any feedback on, because we definitely went back and forth a lot on them.
Yeah, so I'd like to change a few things, like, and one addresses like ear piercing for like younger individuals, right? So like if you can go to the mall and like get pierced with a gun, and like I really consider that to be an uncleanly practice. I would like it changed so that like we could have children, I'd say like from like 5 on, when they can like understand what's happening, come in and get their ears pierced. So we have a lot of parents in town that are concerned about cleanliness, like going to like Claire's or like piercing Pagoda or whatever it is at the mall, that we'd really like to have that changed.
To be fair, you cannot go anywhere in Amherst and get it with a gun, and Claire's has shut down, so that's not available at the mall anymore either.
Yeah, I guess like the Holyoke Mall would probably be what I'm talking about. And then like other towns, I know like you wanted to model a lot of stuff after Northampton. I've heard that like mentioned a few times, and Northampton allows that, allows like children coming to tattoo shops to get their ears pierced as well.
Okay, great. Thank you for that feedback. Was there anything else? You had a few, I think.
Off the top of my head, I don't have anything right now. That's not to say that like things won't come up in the future. That's just the first thing I thought of off the top of my head.
Okay. Well, please don't hesitate to let us know if the goal here is to get the safety right and not to create a bureaucracy that's undoable. So please do reach out if if there's anything further. But
And-
thank you for your time today.
Yeah, thanks,
Okay.
Stephen. And Stephen and I had some conversations. I dropped by the establishment and we talked a lot about I had some questions about some of the different types of piercings, and you gave me very good feedback, which then was brought to the board. So we incorporated some of that feedback already, but it's great to hear from you again today. So thanks, Stephen.
Awesome, no problem. If you guys have any questions about piercings, Jay has been working for me for 2 years, so it's been a while. I'm sorry, I'm getting older. But he's been piercing for like 15, 16 years. Like, he really knows what he's doing. So if you guys have any like real questions about like piercing or anything like that, like, we'd love to help you out. If you have any like real questions about like tattooing or body modification, I've been in this industry since 2003. And I've been around it a lot longer than that. So feel free to ask. I'm more than happy to help you guys out.
Great.
Thank you.
Thank you so much.
Yep, no problem. And thank you.
Great. All right. Our next order of business is the tobacco permit transfer. Back to Kiko.
Yeah, hi. Okay, so this is similar to what we heard back in September when Russell's Liquors changed hands. So this is Lazy Lungs, which is one of the 2 adult-only establishments in Amherst. It's a small shop behind the CVS on North Pleasant Street. So this has now recently been purchased by a new person, Randy Recchia. He purchased the whole LLC intact, didn't create a new LLC. But that's, that's really neither here nor there. One thing that we do need to do is to determine that the business was actually purchased for some value. It wasn't, because tobacco permits are, they're capped. And so we want to make sure that they're passing to someone through a legitimate business sale. And this was that. I didn't send that on to everybody because it would have been a matter of public record, and I didn't think that was quite right somehow to put that in the meeting packet, but we did review those, and this was a bona fide purchase of a business. So he has submitted all of the licenses and whatnot. We sent you a copy of the application that comes to us in OpenGov. It's fairly rudimentary. All the contact information there is correct, and everything is in order for him. I think he took ownership of the business 2 days ago. So it's just about the board approving this permit. The one issue that I did flag, or wanted to flag for you all, is that we normally require for any of the businesses that we license in the town workers' compensation insurance, proof of workers' compensation, an affidavit that's signed, and also a copy of the actual insurance policy. In this case, it's a sole proprietorship. So Randy says that he will not have any employees. It's just he and his son who will run the business. And so he's exempting himself from the workers' comp requirement, which some other businesses have done, like, the popsicle cart that just has one person. They also have done that. The one question I had is that this shop has 2 sides. It has the adult only side, which you can only come into, you're only allowed in if you show an ID at the door. And then it has the all ages side. And so if there are only 2 people there, somebody needs to leave for a minute. I thought, that could be a little challenging to run both sides of the store if you have only these 2 owners that are the employees and there aren't any other employees. I think that's something that we can monitor and be aware of, but I just wanted to make sure that the board knew about that.
How are they separated?
They are, they have 2 separate entrances, and then there's kind of like a vestibule between them that's curtained off or has a closed door between them. So if you're on the adult only side, it says employees only. You can't go through to the other side, and vice versa. So only employees can go back and forth, but customers cannot.
So I guess in terms of where we have, we can ask any questions of the transfer or not, but your concern seems to be that 2 people might not be a sustainable way to run both sides of the business. And I think, can we, seems weird that the Board of Health is the one looking at that particular issue on workers' comp.
I think
it just hasn't come in front of us before.
Yeah, I think it's unusual because this is the first time that I've reviewed a tobacco permit application that didn't have a workers' comp insurance policy. So that's why it kind of, was different for me. I think that the reason it might be, I think whenever I've gone into that store in the past, there have always been 2 employees there. I think it's important to have 2 people there because you cannot, if you're on the adult only side and someone comes into the other side, you wouldn't, you wouldn't be there. You wouldn't be able to see what's happening. So you need to have at a minimum 2 people. And if you only have 2 employees and someone needs to take a break, then that could be potentially an issue, especially when you need to look for IDs and you need to make sure that you are selling to appropriate people. That's where I think it's a Board of Health concern, potentially. Now, I think we give him the benefit. My thought is maybe the board would give him the benefit of the doubt. There's no reason to believe that this won't go well, but it's just down the street. It's something that I might, just keep an eye on. And so I thought it was important for the board to know.
What is the entrance where you look for ID? It's just a regular door that someone should run up to when someone comes in and ask for ID?
There's a bell. You ring a bell. So
okay.
Yeah. So
okay.
Yeah, that's
how
it works.
Better.
Yeah. And
Okay.
it's locked. So you can't just walk in. It's locked. You ring a bell. Someone comes to look at your ID and let you in if you're of age.
Okay. Yeah. I mean, I think it's a really fair concern. I just am not sure. Yeah, how we get involved there other than to flag it and say we need to be sure about ID checking.
Yep.
And the tobacco license applies to both sides or only the adult only? It should be adult only, right?
Yes, correct. Plus. Yeah, right.
Okay. Okay. I don't have any other questions. Anyone else? All right. Anyone want a motion to approve the transfer? And a second?
Second.
Thank you, Jack. All those in favor say aye or raise your hand.
Aye.
And that's unanimous. All right. Moving right along.
Moving right along.
To you. Over to you.
Director's update. I'll make it as quick as I can. As I said, there is a lot happening, and I do want to let you know about sort of the more important things. So Valley Vax, at the last meeting, I promised that the website would be live. It is live, and it was in the newspaper.
I saw it
a week or so ago. Top first story above the fold. I was very happy. And there's a feature on the website where people can send in questions, where we answer them, and we post the answers on our Florida frequently asked questions page. So we've gotten some questions, which has been great, I think, as a result of the publicity. So far we're managing to keep up with it. I don't know if it's going to get to a point where there'll be so much volume that it might be challenging, but so far it's really great to have this resource for people that they feel that they can tap into folks in their local community to ask questions about vaccines. So that's going well so far. The infectious disease update, we have a report, a 2025 report on our infectious disease occurrence in the region. It's not really anything that's earth-shattering. I think rather than talk about it now, I'll just send it to the board so you all can look at it. And if there are questions, we can certainly talk about it at the next meeting. There wasn't anything noteworthy that I saw in the report. I think for emergency preparedness, I shared at the last meeting that I've sort of stepped in to take on a leadership role with the coalition that disbanded when Northampton stepped away. And that's going okay. We have another meeting next week. We're kind of bringing things back together. The main thing going forward is that we just need to establish 2 representatives. I think we have 4 people whose contact information is in Web EOC, which is sort of the emergency database, but we really only need 2 reps to this committee. I am obviously one of them, and it would be great to have another board member to be that other person. Now, Risha has attended one of the meetings. Betsy, you and Risha are the Board of Health members that are listed in the database. So I think it would just be nice to have one person who's kind of the official, like if I'm not available, somebody else could go. And I didn't know if you wanted to make a decision about that or talk about that, think about that right now.
One question I had is we get these messages and I still don't know what I'm supposed to do when I get them.
Yeah.
And I hate taking on a responsibility and feeling like, that I don't know what, that I'm not really doing it in a responsible way. So I feel like I'd want to know what that responsibility.
So let me clarify. There are two separate things. When you get those notices, it's because your name is listed in the database. So if there were an actual emergency, like, flooding or a huge power outage, ice storm, and there was a need to bring people together, you would get that message, emergency meeting of something or other. Right now, all you're getting is drills. You're just getting drill messages. And as long as one person responds, which has always been me, it doesn't matter. You don't need to respond. So it might feel weird to ignore that text message, but unless it's an actual emergency, then you don't have to worry about it. And then the meeting is a coalition of representatives from boards of health in the 21 Hampshire County municipalities to come together and do some emergency planning exercises. Like there will be a tabletop discussion about making sure that every town has an emergency response framework, people designated, some kind of idea of where your sheltering place would be. Do you have cots? Just making sure that everyone has kind of the bare minimum. So those will be exercises that will happen through these meetings, which we need two representatives for. I'm obviously one, and then somebody from the Board of Health would be a good other rep. So maybe that's you, maybe that's Risha, maybe it's somebody else. So those are the two things that we're talking about. I hope that's helpful.
Thank you. I don't think I understood that those were two different things necessarily.
Why would you? It's very confusing.
And I have tried many times to respond to those text messages, and I can't.
Yeah.
Is anyone dying to be part of this? I am happy to be the second person, but I'm also very happy if someone else would like to feel as passionate about it.
I'm happy for you to do it because the truth is I'm traveling a lot these days, but on any given day when you can't do it, please try me, and if I can do it, I would be happy to. That goes for both of you. So I'm happy to be a backup.
Alternate? Yeah. Okay.
Yeah.
That's great.
Great.
Thanks, Betsy.
Kiko, is this the same thing that Northampton is part of, or is this the old system that was in place that Northampton withdrew from?
So the web EOC database, I think Northampton's information is still in that, if that's what you're asking. But the Hampshire Public Health Preparedness Coalition, Northampton used to chair it, and they've withdrawn. Okay. And I'm now the interim chair of that meeting.
Thank you.
So, thank you, Risha, by the way.
What's that?
I said thank you for offering to do that, Risha.
Yes, thank you, Risha. Quickly, Betsy, because this was something you were interested in, the AED idea that you expressed a lot of interest in our last meeting. I talked to Paul about it. He thought it was a great idea. He thought we could use a capital. We could apply for a capital grant, capital funding for an AED project. We would just need to figure out how extensive, where the AEDs would need to go. I mean, I think it's kind of a project that you and I could work on, or anybody else who's interested in it. It's a program, not a policy, really, I think. So anyway, there's interest, and we can follow up on that. I think it might be a nice thing for us to focus on.
Excellent. That would be very meaningful to me. I'd really be willing to put some real effort into that. And
okay, good. So more to come. I just wanted to let you know that I followed up on that. I also want to let you all know that the conflict of interest training that you all did, hopefully you all did, I think it's supposed to be done by Friday. No need for any certificates to be sent to anybody. It all automatically, the information gets populated and sent to the county clerk, to the town clerk. So if you've done it, you're good. Nothing else needed. I think two more things real quickly. So we are operating a warming center here in the Bangs because the weather has been so cold. It's usually the town's practice to send out a press release saying that certain town buildings are serving as warming centers. And we've actually made a more sort of or an actual place for people to hang out here in the banks, because we do have some space. So there's an area down by the main entrance. We have some coffee, we have some ground rules. Staff go and check in on folks, and there is a regular bunch of at least 3 to 5 people who are coming here every day and it's been going very smoothly. So I'm glad that we've been able to offer that service, because there isn't any other kind of a drop-in warming center here in Amherst. Craig's Doors runs a resource center. Their pipes are frozen at the moment. It's also it's a trailer, so this often happens to them in the winter because it's all the external plumbing stuff. I hope they're going to get it back online. It's also a very small space, so it's just nice that we're able to offer that to people in the community. And then the final thing is just to build on some of the comments that were made at the beginning of this meeting about the fire site. So I have been receiving some concerns from Juliet. Megan, you heard from another person also reached out to me with concerns about air quality issues during this time that the rubble or debris removal is happening. I actually have not been to the site myself to understand how prevalent the dust in the air is when this is happening. And I also don't know about this groundwater contamination issue, Jack, that was raised. Somebody was concerned about that being possible problem, fallout from the fire. So I'm not an environmental health expert. I'm doing my best to sort of, manage it. We've sent some information out. We've suggested that people wear masks if they want to. The other thing that I've done is I've applied for some air sensors for the town of Amherst. And our application was accepted and granted. So we'll be getting 5 of these purple air sensors, which are part of that purple air map you can go on to. We'll be putting them around the town, and there is been a request to put one at Olympia Oaks because of what's going on with the debris and whatnot right now. So that hopefully can be installed in the next week or 2 is the hope, which I think the community will appreciate. But it's clearly something that folks are concerned about, air quality. Mostly the neighbors at Olympia Oaks that are right near the fire site. I'm not hearing from other people in town about it. It's a very localized thing. So I just wondered if anybody had things they wanted to weigh in about that, especially people who might be more savvy than I about environmental health.
Go ahead, Jack.
Yes, I would be interested in the air monitors. Kiko.
Yeah.
Just if you could pass that information along, I'd be interested in that. And then with regard to the groundwater, I think the sensitivity of that area is fairly low with regard to any sort of drinking water supplies, i.e. it lies outside the immediate watershed of any water supplies that serve the town or any private wells. So the only other concern would be like a groundwater plume of some sort of dissolved constituents that would cause a vapor intrusion concern, and there would not be any of that. There would not be a plume generated of that nature from this incident. So I think that the groundwater issues are moot for the nearby residents, especially where the depth of groundwater is probably fairly deep there.
Okay.
Now, if there's wetlands nearby, maybe that's another, sort of issue. But even that would be, I think, just be very minor, de minimis. So that's just my initial thoughts on that.
Okay. That's helpful. And I think that in terms of the air quality, I'll definitely, I can send to you that if you're specifically interested, the application that I wrote, and then the map, the proposed location for the sensors. I think it'll be great to have those data just in general for the town about air quality. And I'm not sure what else. I think Mass DEP, I was told by staff here in town, are normally very conservative, and if they felt there were immediate risks to health and safety, they would have weighed in and done something or asked the town to do something specific, and that hasn't happened. So I think we want to do our best. You know, the rubble remover folks are following the guidelines they're supposed to keep dust to a minimum. There's a bus stop nearby where kids are waiting for the bus, so we're looking at, can we move the bus stop? I've been in touch with the schools today, you know, recommending that people wear masks if they feel like that's something they need to do. At this point, I don't know what else to do. I'll keep learning and communicating with residents, but if anybody else has any other thoughts about it, I certainly welcome those.
Yeah, I mean, would just say that if there is an odor, which is, you know, entirely possible, that that our sense of smell, whatever, it's pretty amazing. But that does not mean, so it turns into more of a public welfare thing in terms of an odor versus any sort of real health threat. But from a public welfare standpoint, you know, I think that's part of our jurisdiction. I'm not sure, but yeah, if there's an odor there, then again, you know, suppressing it by, you know, essentially by the removal, I think is going to do the most good. But
yeah, okay. I think the neighbors are happy that the removal is happening. I think they're just concerned about that process and how they can stay as safe as possible during the removal process. So other than avoiding the site and wearing a mask, if you have to be near the site, I don't know what else to recommend.
Yeah, a mask is not necessary. I mean, it's really, if you're annoyed by the odor, then that's, you know, personal preference, whatever. And I'm not sure a mask will really help with that, but
yeah. Well, I guess if there's a lot of particulate matter, a mask would help, but I don't know how much particulate matter is going to be kicked up during this process.
Yep.
Okay. Thank you. I think that's it for me.
Okay. Any issues not anticipated within the 48 hours? Betsy?
I don't think this is going to be an action item, but I just want to acknowledge the number of people who've been concerned about some of the health, you know, more loss of primary care doctors in the area, and whatever the impact of Medicaid cuts might be on the robustness of our, you know, local healthcare. And I know this is something that there probably isn't any, it's a national problem. It's probably not anything that we could do anything about. But, you know, we've talked about how this has been a concern for people. And I think just to say it out loud that, you know, that there's, certainly within my friend network, I've been hearing a lot of people saying that their, you know, providers are leaving the areas and they're very unsure about who's coming to replace those providers. And I do think we're kind of approaching a real area shortage of primary care doctors. I was completely on top of the pediatric world, but I'm not sure how that's playing out now. But I think a very high percentage of the local children, somewhere between 40 and 50%, are covered by Medicaid. So these cuts may be, you know, quite difficult in the local pediatric communities.
Yeah, as you said, I don't know what our action item could be, but I think it's worth getting it on the record. And I was not aware of it, so I'm glad you brought it up. Kiko, did you have any other response?
I just wanted to say that I attended an excellent presentation today by the Blue Cross Blue Shield Foundation, two very well-informed folks talking not so much about difficulty locating primary care providers in Western Mass, but about the coming cuts to Medicaid through the change in eligibility requirements and all sorts of things. Hundreds of thousands of people are going to lose coverage. And it was very well done and very informative. And you know, it's not exactly relevant to the kind of policy making that this board would do, but if you all are interested in just getting up to speed on what is coming, and it is a depressing conversation, I will tell you, we could certainly organize. They were willing to do that talk for others. We could do another webinar and invite more people. I found it helpful just to know. It's good to know what's coming. As awful as it is, it's good to be informed. So if that's something that you think might be interested in as board members, you would want to attend, I could organize it.
I would be interested in being knowledgeable about that, staying informed.
I would too.
I would be interested at watching a pre-recorded webinar at my leisure versus having a scheduled attendance.
Sure.
Live one. So if they're able to pass that along, that would be great for me.
I think that's perfect. I can see if that's possible. Yeah. Okay.
Great. I recognize that we are at time. However, I would like to give one more chance for public comment for those who are still here. So if you would like to say anything, please raise your hand and Maheen will let you in.
Okay, Laura Romney, please unmute yourself.
Laura, you're still muted.
Okay, I think I'm unmuted now.
Yes.
Okay, great. Hey, thanks. Thanks for letting me speak again. So I just wanted to tell you that I'm very happy with what you've voted on today. I feel like you are absolutely in the right direction as far as how you're setting this up. I did want to bring a couple of things to your attention. Like, you know, the powder that you showed that was called like Simba or something like that is what it was labeled. That, from what I can tell, would not qualify under your specific law because what I sent you in that email, it had had good examples of product where you could actually go in and see, you know, labeling and dosing and batch numbers, because then that's how you do know you are consuming safe products. And you know, the reality of it is you are correct that you could go into your smoke shops or wherever and find out that every single product is not going to qualify. But that's fine because then it will be up to the vendor to come back to you and say, you know what? I now know what I need to sell and I've come to you with a good, you know, good product that I can show that's been tested and, you know, there's batches and labeling and all of that. And then you can happily sell it on the shelves. So, you know, because even the drinks, like you were showing me, like I couldn't tell they were too small. I would have to actually look at those drinks to see if, you know, if they were necessarily 70H or if they were, you know, not. One thing that is not a 70H product. That is it's a combo, it's a kratom kava combo. So basically it is not a product that you can, you know, that you can say that is pure kratom. It's not. It's a combo product, but it's not 70H. Another thing is, I know I'm just looking at my notes here that you had. I know you talked about like educational materials. So in the email I sent you, I copied Jen Mercier. She is one of the vendors that has one of those products down below that I had on the email. She is an excellent vendor that actually is incredibly involved in education. And I texted her during this and said, hey, do you have educational materials that you could share with Amherst? And she said, absolutely 100%. And she said she would be happy to work with you to help you kind of identify. She lives very close, by the way. She could help you identify, you know, what is good product and bad product on your shelves to make sure you guys are in compliant with your new ordinance. But I do, you know, I appreciate, I think it's a great idea to only put it in adult stores 21 and up. I think that's fine. The other thing is I will send you the South Hadley ordinance. I do have that because they shared that with me. And so I will email that to you all. And the only other clarification I was going to have was that, you were talking about powder versus leaf kratom. The reality of it is, actual look like tea leaves type thing is very, very rare. Most consumers never ever use that. Some people, you can order it places, but that's very rare to find. Most consumers are going to be using the actual powder form, or they will use the natural extract. So again, I'd have to look at your shelves to know if you even have any actual natural extracts on your shelves. But again, I'd be more than happy to work with you, or Jen Mercier could, to identify, it's really easier than you think to say, okay, this product matches that 2% that you're talking about. I know it sounds complicated, trust me, but it's actually quite easy once you've seen a couple of products and can easily identify what is quality product and what is not. So like I said, I'm happy to help you. You've got my number, my email, and you've got Jen Mercier. I'll send you her phone number as well, because again, just because she's so close to you guys, she'd be a resource to help you guys set this up so that you really, honestly, you could have the model ordinance and the model way you've set this up for the whole state of Massachusetts, because you guys, even though places like South Hadley and things have got it in place, it's new. And so they're still trying to put systems in place, and you guys could actually have a great program in place that is still letting it be available to those people who really need it, but yet it's safe.
Thank you, Laura. Thanks.
Appreciate it. Thanks again so much.
Thanks. And I think there's another hand.
Jennifer Mercier, I'm going to ask you to unmute.
Hi, can you hear me?
Yes.
Yep.
Hi. So I don't want to be redundant. I did just hop on just again to offer, because I am close. I'm just right over the border in New Hampshire. I think I'm less than an hour, and I've offered my time before to come help people kind of distinguish between a good product and a bad product. And I just want to say that I'm not a paid advocate, and although I'm a vendor, I'm a very small, eensy weensy little vendor, and I'm not actually in a lot of stores, but I am in a health food store, which is very exciting. That would be my only concern with allowing it in just 21 plus, but I don't think any of your health food stores carry it, so that's kind of my pipe dream. I love the idea of education. I have the Essential Guide to Understanding Kratom. I have harm reduction work, forms and sheets and all this stuff that I love handing out to people, just so people understand what the product is that they're getting. So I'm available for questions. I would love to come and visit and go through your stores with you and help you do stuff. And I really appreciate you saying, that you guys were concerned that you haven't heard from anybody from your community. And the truth is, nobody follows politics. It's really, very few people do. So the average kratom consumer, unless you're a very outspoken advocate, they don't know. And, we can only do so much. There's so many things happening all at once, where I have actually called shops before and said, you better get there and you better do something. And it's hard to get the word out with any amount of time. So I really applaud you for that astute observation and being willing to get out there in your community and see what the people want. So yeah, I'm here for, again, questions. You have my email. Laura Romney forward my information, I believe. So thank you.
Thank you so much. And there are no other people in the attendees room. So with that, we'll make a motion to adjourn the meeting.
I just want to say I will be out of the country for the next meeting.
Okay.
So.
Okay.
Oh, me too.
Okay.
Yep. There goes our quorum. So we will. We're going to have to end the official meeting before we ask him, but we will figure out how to probably reschedule, it sounds like.
Okay. Thanks, everybody. Thank you, Risha. Take care, everyone.
All right.
Thank you, Reed.
Thanks,
Thank you,
everyone.
everyone.
Night.
Bye-bye.
Bye.